I'm here today with GAINSWave provider, Dr. Bruce Sloane, who's in Philadelphia, Pennsylvania. And Dr. Sloane, if we can just start off with, if you can just kindly tell me about yourself, your specialty, your practice.
Yeah. Hi, Jeremy. Good to see you. Well, I'm a solo practitioner in Philadelphia. My practice is geared towards men's health. That's most of what I do. Testosterone replacement therapy, erectile dysfunction, prostate cancer, BPH, kidney stones. I'm in practice for almost 30 years now.
How long has GAINSWave been part of your practice now?
Just over 3 years.
Over 3 years. And what features of the GAINSWave program do you find most valuable? Is it the sales and marketing material, the business support, the lead generation, the general community at large?
Well, a couple of things. I think it's the, obviously, it's the results and the protocol. I think that a lot of thought has gone into it. And I like the fact that there's a very specific protocol based on anatomy. So that's one thing I admired. I also think that GAINSWave has a great brand. I think you guys operate with a lot of integrity. I have a lot of respect for Mark and you guys, and you as well, Jeremy, and everybody else. Everything they've done to me gears towards quality and honesty, and there's nothing about it that is shady or trying to do things or promote things that aren't true. So I really like that aspect of it.
That's kind words, Dr. Sloane. And we do pride ourselves on clinical excellence and best practices and quality control, of course. How have your patients responded to the GAINSWave treatment? Good outcomes?
For the most part, very well. I don't really know about any other practitioners. I'm particularly picky about treating people because I don't think this is for every patient that walks through the door. But for the ones that do, and I have to say that I do turn away a good number, but I mean, not as many as I treat. But it's been quite good. I think the success rate, in my experience, is what has been quoted in literature. It's about 75 to 80%. And that's been my experience. I think that could be higher if a number of the patients who don't respond to the 6 would get another 6, but sometimes it's difficult to have somebody spend some more money with the somewhat uncertainty of whether or not it's going to work. But I will tell you overall, this has worked very well. Otherwise, I wouldn't keep doing it after 3 years.
Is there a specific GAINSWave patient story that stands out to you?
I'll tell you, one of the first patients that I did, who's still my patient, and he's one of these gentlemen who really is a very forward-thinking guy, businessman, owns his own business, and he was my first GAINSWave. And I remember I saw him, I like to see my patients a month after the last treatment. He came in with a thank you card from his girlfriend. So, which I saved. I never forget that because he was so happy with the results that his girlfriend wrote a thank you card thanking me for the enhanced performance that I provided him.
That's a wonderful story. We tend to forget, us guys anyway, that we are the only ones that are affected by erectile dysfunction, by ED, but it also affects our partners, the people that we're in love with and the people that we're intimate with. So that's a lovely story. What would you tell a fellow doctor who's considering adding GAINSWave into his or her practice?
I would say if you're committed to treating patients with ED and you're comfortable with the workup of a patient with ED and who would be a good patient, and you want to add a non-invasive, very effective, what I think cutting-edge treatment to your practice, this is the way to go.